Have you ever wondered why so many people suffer from heart disease, things like heart attacks, high blood pressure, or strokes? The thing is, these cardiovascular diseases are a major obstacle to staying healthy long-term and living a long time. So today, I'm going to describe exactly what these conditions are, what some of their major consequences are, and most importantly, what you can do to prevent them and improve your longevity. Hey there, I'm Dr. Anna. I'm a medical doctor, and on this channel, you are going to learn how to master your health with the right moves. Okay, so first, let's dive into the world of cardiovascular diseases so we can better understand them in order to know how to prevent them. So what exactly are cardiovascular diseases? Well, quite simply, this is a group of disorders that affects the heart, the muscle tissue itself, and also all of the blood vessels that branch off of it and go throughout your body. So it's a cluster of diseases that can happen both locally at the level of the heart and sometimes other places too. So this includes things like heart disease and atherosclerosis related diseases, which can cause coronary artery disease, plaque buildup that then can cause a heart attack or even a stroke. And it is well understood that these diseases are the leading cause of death worldwide. This is not just a problem in the United States where I am right now. This is actually a problem everywhere. And the truth is that many of these diseases are preventable with the right lifestyle interventions. So let's break down each of these different cardiovascular diseases one by one so we can better understand what they're all about. So let's start with the most common, which is heart disease. Heart disease is actually a category of conditions. There are conditions that affect the heart muscle tissue itself and also the blood vessels that supply the heart muscle tissue. These are known as coronary arteries. So coronary artery disease, being the most common heart disease, is caused by usually fatty plaque buildup, otherwise known as atherosclerosis, that can then clog up those arteries. And what happens is the blood supply to the heart tissue gets blocked. And if we can't supply oxygen to the muscle of our heart, we can't actually have the heart pumping adequately. And if that happens and the heart cannot pump adequately, it is life-threatening. And this is what happens in a heart attack. Now, how does this happen most of the time? Well, it's not just a snap of the finger. Suddenly, someone's in a situation of a heart attack. Usually, this disease is building up slowly over many, many years, if not decades. Actually, there's research now showing that plaque buildup, and fatty plaque specifically, inside coronary arteries can start really early on in life, even in the teens. So this is not something that you can just put off until you're in your 60s or 70s thinking, okay, I don't have to worry about this until I'm in my older years. That's actually not true. All of us need to be worried about this and thinking about this as early as possible. So unfortunately, what happens is people are often going many years not realizing that underneath the surface, the disease is actually present. And then all of a sudden, they're at the later stage where they start feeling symptoms. And this is often presenting in something called angina, where people have the heaviness that they feel in their chest. They get out of breath really quickly. At first, that might happen just when they're exerting themselves or when they're exercising. They're trying to ride a bike, they're swimming, and all of a sudden they notice they're way more out of breath. But slowly, that can build up, and people might have those symptoms in more calm activities, even just like walking, going up and down the stairs in their house, for example. So you can imagine how this sort of feels like it's creeping up slowly, and then suddenly somebody has an event. Now let's talk about another one of these cardiovascular diseases, and this is stroke. Stroke is where blood supply is actually blocked to the brain. And people are going to present when they have a stroke with symptoms showing that their brain function is compromised. They might lose the ability to move a limb or to walk. They might lose the ability to talk. The classic presentation is where somebody's facial muscles start drooping because they no longer have the blood flow to their brain that controls those muscles. Now, strokes might present differently in different people, but the concept there is that usually if it's from atherosclerotic disease, a fatty plaque gets broken off somewhere in a blood vessel and travels to a blood vessel supplying blood to the brain. And when that blood flow is blocked, that is what a stroke is. Now, it doesn't always mean that it comes from an atherosclerotic plaque, because that is just one type of a stroke, which is called an ischemic stroke. There's also another type called hemorrhagic. That is where instead of blood flow being blocked by something inside the vessel, there's actually a break of the vessel and you're bleeding in your brain itself. Now, that is a lot less common, and I know it sounds really scary, but but I just want you to be aware that that is also a type of stroke. And now let's just talk quickly about hypertension, because hypertension or high blood pressure is so common in our population pretty much everywhere in the world now. So hypertension can be caused by a lot of different things, but it's when your body needs to put more force into the pumping of the blood in order to get it flowing throughout your body, because something is happening, usually at the level of the blood vessels themselves, that makes it really difficult to transmit the blood through. What can happen is calcium, which is a mineral, starts getting deposited in the blood vessels and it makes them really stiff. And blood vessels are, you could think of it like a straw, but they expand and contract all the time throughout the day, controlling the amount of blood flow that's going to a certain part of your body. And that makes sense. Picture when you're riding a bike or walking or you're doing some kind of exercise, you actually want more blood flowing to your muscles where they really need that oxygen. And so in order for that to happen, the blood vessels need to expand or grow larger to get more blood flow going in there. And then at other times when you're sleeping, for example, you don't need as much blood flowing to, let's say, your calf muscle. So that would be a time when your blood vessels could then contract and get smaller. So the ability of vessels to grow and expand or contract and get smaller has to do with the stretchiness and some of the small muscles actually around the vessels. So in high blood pressure, that property gets compromised, and then it makes it really hard to control the amount of blood flow to certain places, and it puts more pressure on your entire cardiovascular system. And the thing about hypertension, similar to atherosclerotic disease or the fatty plaque disease, is that it can be considered a silent killer. You don't necessarily feel symptoms for many years, even though it's going on beneath the surface, until it's a little bit too late or you have a major event and you have a problem. Now, this is not just true for hypertension, but is also true for the other cardiovascular diseases. Regular monitoring and management is paramount, because the name of the game here is you want to prevent further complications from arising once the disease is already present. Now, here's the really big problem with this entire situation. We know that cardiovascular diseases are the #1 cause of death worldwide. So they're really common and they're really tricky to treat if they're not managed correctly and addressed early on. And classically, heart disease and all cardiovascular diseases are going to cause a lot of problems for an individual person's quality of life. It might affect their ability to exercise, to spend time with loved ones, to even stay fit at their workplace to do their job correctly. But it's not just a burden for an individual person. At large, when it's so common and it's so intensive to try to treat some of these things, that adds up to all of the burden and all of the costs on the entire healthcare system. And this is seen globally throughout many different countries. Not to mention that all of these conditions, they're not exactly pain-free. They're very uncomfortable, and a lot of patients tell me all the time that it's really, really significant pain that they're feeling when they're having their symptoms. So if you can prevent feeling this kind of a pain, wouldn't you want to do it? Now, if you are finding this information useful so far, and I really hope that you are, please subscribe to the channel because it helps us get this information out to more people who really deserve it. Now, here's the good news, and I alluded to this at the beginning, but most of these conditions of cardiovascular disease are in fact preventable. And what's more important, even if the disease is already present, complications and further worsening of these conditions is also preventable. And this is where the magic happens. We can actually take actionable steps today, wherever you are in your journey of health, to make things better for your future, and maybe even make it better for you right now. In other words, we're probably able to increase and improve our longevity and our ability to live a long time feeling well if we apply the right tactic. So this is how I see this working. There are several different things that you can do to help decrease your risk of complication or decrease your risk of getting these diseases in the first place. And I like to break it down in the following way. Think about adding all of these things in together like a mixed soup, where you start up by doing a little bit of all of them, you increase it over time, and lo and behold, you have created for yourself a healthy lifestyle. So this is how it breaks down. What are the ingredients of our longevity soup? Well, it starts with healthy eating. Now, if you've ever seen any of the other content on my YouTube channel, and I sure hope you have, you're going to know that I'm very food forward when I think about health and wellness. I think nutrition is paramount for everyone. And it's not to say that we all need to be neurotic about it and obsessive. We just need to pay attention to it and make sure we're doing the best job we can with the resources we have at that time. There's always room for improvement with healthy eating, but it's about making changes now. So when it comes to cardiovascular health, there's a lot of research showing benefit of eating a lot of fiber-rich foods, a lot of polyphenols, which are healthy molecules inside of plants like vegetables and fruits. Eating a lot of healthy oils, things that are rich in monounsaturated and polyunsaturated fats, classic in an oil like olive oil, and eating lots of lean proteins. Proteins like beans, lentils, things like nuts or seeds, some protein in whole grains, and then lean animal products. Why? Because it has a less saturated fat, which has been linked to heart disease. And for some people out there to say, no, none of that's true, I'm telling you, this research has been going on for decades. It's not new. So the name of the game with cardiovascular disease is to decrease your risk for that fatty plaque buildup and to decrease inflammation, both of which are going to lead to some of these disease states. Now, the easiest way I can explain a healthy eating approach is by following something like the Mediterranean diet. It is one of the most evidence-based dietary approaches to preventing disease, especially heart disease. And I have so much content on this YouTube channel about how to get started with the Mediterranean diet, what kinds of foods you want to include, what tricks of the trade are important to keep in mind. Check out any video on this channel, and I hope that you learned something. But that's not to say that diet is the only thing that matters. We also need to include in our longevity soup the next ingredient, which is healthy exercise and exercising enough and of the right amounts. Now, the classic thing that's recommended is to get at least 150 minutes of moderate intensity exercise a week. Well, what is that? Moderate intensity is stuff that gets your heart rate a little bit above a typical walking pace. So you can do this by bike riding, swimming, running or jogging, rock climbing, doing boxing. I mean, there are a lot of different activities that are going to be moderate intensity. The point is, you don't have to go out for an all-out sprint just to help your heart health, although that is also a good idea. If you're in a situation where you're able to actually run or bike at a very high pace, that's very good for your heart. But the goal is to get enough time doing cardiovascular types of exercises. In other words, cardio exercise. That's why we actually call it that. But it's not the only thing that matters. We know that weight training is also really important for overall metabolism and metabolism regulation. And heart disease is a disease that includes also all the blood vessels. And so remember earlier when I talked about the example of blood flowing to your muscle during exercise, well, that's also healthy for your vascular system. You want to make sure that is getting regulated and challenged. Now, the physiology of all of that is very nuanced, so we're not going to get into that level of scientific detail on this channel because this channel is just about giving you the tools you need to get started today. But if you are interested in that, I have some links below that's going to talk a lot more about cardiovascular disease and healthy habits that are going to improve your risk for some of these conditions. Now, the next step of our longevity soup is really easy. This is to avoid smoking and excess alcohol use. I don't think any of you are going to be surprised that this is classical in helping protect your heart and your vascular system. We know that smoking and excess amounts of alcohol are very damaging to our body on many levels and in many organ systems. So this one's just kind of a no-brainer. If you're trying to keep a healthy activity level and a healthy diet, but you're still smoking and drinking a lot, it's not the best that you could do. The goal is to get towards a healthy regimen as much as possible. I recognize that for some of you who are already smokers, it's easier said than done to quit. And for some of you that are drinkers, it's part of a lifestyle that you're probably used to. So talk to your doctor and try to do the best that you can to eliminate these things as much as you can. But these are not the only things that we can do for our heart health and our overall health. It's also about managing stress. And there's a classical thing where stress gives you a heart attack, or people say, oh my gosh, you're going to give me a heart attack. Well, let's think about where that actually comes from. Is that how it works? No, a bang of anxiety is not necessarily going to cause a full-blown heart attack, but there are some instances where people have conditions that relate to the amount of stress that they feel, and it can impact your cardiovascular health in the long term. So stress is important, and it is something to manage. Classically, people can do things like mindful meditation, taking time in nature, talking to someone, like a loved one, or even seeing a counselor or a psychologist. There are a lot of ways to manage stress, and I'm sure there are tons of YouTube channels that are really equipped with giving you the tools you need to address mental health. More expert than I am in that area. But overall, managing our stress is very important for regulating our cortisol and our blood pressure. So make sure you're addressing this. And the last part of our ingredient soup is to get regular health checkups with a doctor or a nurse practitioner, whoever you regularly see for your health care. It's important because, as I mentioned earlier in the video, A lot of these conditions kind of creep up slowly. You're not going to necessarily feel that the disease state is present, even if it's starting to occur inside your body. So you want to make sure you're getting your blood pressure checked, you're getting those labs in, you're getting that annual visit with whoever you get your care from. Your life could depend on it. Now, I want to ask all of you watching, what steps or what things are you currently doing to address your heart health? Comment and share below, because we learn from each other in this community, and the comment section is what it's all about. And if you've been finding this video useful so far, please like it and consider sharing it with a loved one, a friend, a family member, or a neighbor, someone who you think could really benefit from this information. Now, for more information about what you can do to prevent things like heart disease now, with lots of tips and tricks, I encourage you to check out all the other content on this channel. I have so many videos dedicated to trying to make a healthy eating regimen and a healthy lifestyle as practical and applicable to you as possible, so you have the tools you need to get started today. Jump into that content. I'll see you over there.